Hi again. So this discussion topic is going to be about infection, the idea of infection. As I developed low dose immunotherapy around 2009 and built on it from there with all the different things I learned I could treat with this, I had to really change my concept of what the word infection meant. A true infection, my new definition of a true infection is a microorganism gets into some part of your body where it does not belong. And it doesn't belong there either because it's normally a sterile compartment and no organisms belong there, or it doesn't belong there because it lives, in some other part of the body, but it's not welcome in this part of the body, and it's, reliably kind of rejected and causes an inflammatory attack by your neutrophils and certain lymphocytes and members of your immune system. And it's a predictable situation in everyone, okay, not just some people who get it and other people don't. Some good examples would be, otitis media. You get respiratory flora out there in the middle ear cavity, and the conditions are such with mucus and swelling that they build up enough population there because it's not draining properly, that it creates this big pus pocket, swelling, pressure, inflammation, pain. It doesn't belong where it is in those numbers, at least. So you treat it with antibiotics and people just get better. They don't have a die-off reaction. A very important thing to understand is that a die-off reaction means, by definition, that the condition you're treating is immunologically driven, not an infection, but an immune response condition. That's a very important thing to point out because true infections do not exhibit Herxheimer reactions. So if you treat a bladder infection, let's say, like a typical uncomplicated cystitis, not someone with interstitial cystitis, which is a immune-driven chronic situation, okay? Simple, uncomplicated cystitis, usually it's stool flora, right? Bacteria from your bowels end up in your bladder where they don't belong. The bladder is supposed to be sterile, arguably. And you have an inflammatory response, your body has to kick it out, and you take antibiotics for 3 to 5 days and you're all better. You move on. If somebody has interstitial cystitis, you often don't even grow anything, right? They have bladder pain and frequency and burning and dysuria, and you get a urinary culture and there's nothing there, right? So you don't even call it an infection. That's why they're apt to call it interstitial cystitis instead of saying chronic UTI, because you don't even have the evidence. But you can treat interstitial cystitis with LDI. You can also treat recurring UTIs with LDI. We have some people who get frequent bladder infections. It just keeps happening over and over again after sex or just randomly, excuse me, or a certain time of the woman's menstrual cycle maybe. And you can give them LDI mixture we have of urinary tract bacteria, ones that don't necessarily live there normally because it's supposed to be sterile, but common UTI causing organisms that are, they live in the bowel usually and they're neighbors. But we have this mixture and it frequently works to just stop the woman from having recurring UTIs. One big discussion topic that always comes up when I'm talking to people about the difference between infection and immune response condition is Lyme disease. But I would lump it in for this conversation with anything you consider to be a chronic infection. So chronic infection should not be a thing. I want you to put that in your mind as a new kind of truism. You shouldn't have chronic infections. And chronic infections, in almost all cases, are actually immunological reaction conditions, not infections. A good example would be acne. We treat acne as if it's an infection on your face with antibiotics, right? Excuse me, either topical antibiotics or oral antibiotics. But the thing is, the organism that is thought to be responsible, Propionibacterium acnes, is present on everyone's skin. It's ubiquitous, it's normal flora. So why is it an infection in some people and accepted and with no inflammatory reaction against it in other people? Whenever you run into a situation like that, you should think that the condition is actually immune driven and it's not infection at all. It's like an allergy to an organism that lives on your skin normally. So I have a skin bacteria mixture we put together called SFB, skin flora that's bacterial. And it works for acne a lot of the time. Interestingly, sometimes it doesn't, and sometimes the antigen involved with acne specifically is foods, and sometimes it's hormones. But it all looks the same and it manifests the same. So it's one of these eclectic conditions you'll have to learn about. hidradenitis suppurativa, which is horrible, but it's an immune reaction, in the sweat gland areas, armpits, around the midsection a lot of the times, and in the groin, and it's just horrible for people, painful and disfiguring. That responds to this SFB mixture too. It's not necessarily thought of as an infectious disease. Sometimes it is, sometimes it's not. I'm not sure how dermatology classifies it, but it is an immune response driven issue because it responds to LDI. And I think the organism responsible is Corynebacterium, for sake of argument, which is in the SFB mixture. In the area of Lyme disease, forever, it's been thought of as an infection that's introduced, from a tick bite or some other blood-sucking arthropod. And it gets into you, and it's the organism itself that causes the illness. So that's kind of the belief with infection, is that the organism itself is causing the illness directly, or because the organism is someplace it doesn't belong, and it's mounting a necessary and expected immune response from the person, which is a defensive immune response, not a hypersensitive immune response. So that's an important thing. I can treat Lyme disease extremely effectively with LDI by just stopping an immune reaction to the organisms, which means it's not an infection. Like if it responds to LDI, what you're dealing with is not an infection. And when I was treating patients with Lyme disease many years ago, more than a decade ago, giving them antibiotics and what have you, even tried homeopathics for a while, you would get limited success. I mean, those of you who use antibiotics for Lyme should be honest with yourself. You get very limited success with that. And it's puzzling as to why. And not only that, why do you have to treat people with antibiotics for more than 6 weeks? You don't even have to treat osteomyelitis or endocarditis for more than 6 weeks to eradicate it in general, right? So why would you need 6 months of antibiotics to try to help somebody with Lyme disease, or 6 years for that matter? So when I started to think about it that way, and I had been doing a lot of immunotherapy already, I started to realize that Lyme disease is not an infectious disease, it's an immune reaction to an organism. And when you start to look more at Borrelia and how it behaves and lives in human beings and where you find it in everybody all the time, pretty much. It's not just in sick people. You can find Borrelia in totally healthy asymptomatic people, which right there should also tell you that it's not really an infection, because if it's an infection, everyone who gets it should get the disease, more or less. I mean, strep throat is an example where 90% of people will get it. Will get strep throat, and about 10% of people can carry Streptococcus pyogenes asymptomatically. So it makes you wonder if maybe strep throat, acute strep throat, is an immune response disease too. And it might be. It definitely causes a number of autoimmune conditions, Streptococcus does, guttate psoriasis, pandas, rheumatic fever. There's a pretty significant list of diverse multi-system autoimmune disorders, and you can treat them with LDI, not antibiotics, turns out. So, sorry, fighting a cold. It's an important thing to think about with anything chronic and with any condition that you just sort of wonder about, that you've been taught is an infection, but it goes on, and treatment goes on and on. Like with acne, you treat with antibiotics for years. Recurring cold sores is another one where people think of it as a reactivation of the herpes virus. But in actuality, it's your immune system reacting to the virus that's been there for years and will be there for the rest of your life. Right? You get herpes simplex 1, it's never leaving your body. Some people never get cold sores. Like I don't get cold sores, but a couple of my daughters and other women in my family get cold sores regularly. And we've all got the same virus. So what's the difference? The difference is whether or not their immune system reacts to it in an abnormal way. So we can use the herpes simplex LDI and stop them from having those events, which is fascinating. So this is a big topic. I want you to think about it. I want you to open your mind to reprogramming some of your pre-existing beliefs about things being infections or not, especially Lyme disease. If you've treated Lyme disease before, you really need to rethink it as an immune reaction condition and not as an infection, because otherwise you'll really run into roadblocks in your mind and your practice. Also in the acute setting, so even acute Lyme disease, tick bite, erythema migrans, fever, horrible symptoms, even 2 days after the tick bite, LDI works. You don't need antibiotics. And it's just because this organism lives inside of us. It's supposed to live in us normally and naturally as part of our normal flora. It's in our interstitial spaces and tissues, and we're not supposed to attack it. We're supposed to get along with it fine. And LDI can achieve that for people. So the organism doesn't have to go anywhere. You don't have to kill it, but you can stop the symptoms and the disease process and make the person totally well by restoring normal immunological tolerance for an organism that lives there normally. And that's an important thing to think about when we're dealing with this process. Another one I would bring up is psoriasis, which is considered to be an autoimmune disorder, but I've determined and proven through use of LDI that it's actually an immune reaction to normal fungi that live on your skin. But if the dermatologist knew that it had a fungal cause, they might think of it as a fungal infection, because it looks awful lot like it. It looks like out of control ringworm, right? But it's not thought of as that. It's thought of as an autoimmune disorder. But why? Why don't we consider Lyme disease an autoimmune disorder? Why do we consider psoriasis an autoimmune disorder and not a fungal infection of the skin? So it's all messy, and you don't have to necessarily decide to call one thing an infection or not. But I want you to think about whether or not the situation in front of you is amenable to LDI through immune desensitization. That's the big point.